Hi guys, welcome back. If you're new here, my name is Charity. I'm a pharmacist, and today we're gonna have a yipper yapper session. I don't really have, by the way, hydration. Um, I feel like I have a bunch of random different topics to kind of cover. So let's just dive right into it. First, let's talk about Rite Aid filing for bankruptcy. The signs were on the wall. The writing was on the wall. We all knew that that was going to happen. It was the inevitable. And people have asked me, like, what do I feel like that means for retail pharmacy? What do I feel like it means for retail pharmacists? And my honest opinion is that I feel like the real question is, what does it mean for patients? Because I feel like patients are going to be the ones who are most impacted. And I say that because you go from having 5 choices, 6 choices, to every few years less and less choices, whether it's because there are less pharmacies open or because your insurance is limiting where they will cover these medications or how often you have to go to these places to get your medications covered. Like, your ability to choose is being greatly impacted. When you have so many people on medications and you have so few places to fill your medications, everybody's going to the same places. Think about a DMV, how long the waits are, those types of things. What does that mean for the quality of care, the efficiency of care that you as the patient are going to receive? So I think we're looking at it from the work perspective, and don't get me wrong, we will be impacted. We will adjust as we can. Like, I'm sure pharmacies will utilize, automatic dispensing devices. I'm sure they will, initiate more remote verification. They have some resources at their disposal that they can use, but you as the patient or patients, they only have so many resources, and they're the one who is ultimately impacted. Am I worried as a retail pharmacist? No. Should I be worried? I think that's a bug on the wall. Should I be worried? Maybe. Maybe I should be worried. Maybe I'm naively not being worried. But what I will say is that I work for a pretty good company, and they tend to do a really good job of preparing us and giving us resources to make sure that we can take care of our patients, that we can take care of our staff. So I think that when we get to that bridge, we will cross that bridge, and I'm pretty confident that we will be successful. So there's that. What's next? The next news was CVS Caremark not joining an alliance with Novo Nordisk to only cover Ozempic. Did I see that coming? No, that was not on my bingo card. Rite Aid closing, always on my bingo card. That was not on my bingo card. Am I shocked? Heck yeah. Why am I shocked? I'm shocked because while GLPs, they're a class of medications, right? So you have Ozempic, you have the Wegovy, you have the tirzepatide, which is the Zepbound and the Mounjaro. You have Bydureon, you have Saxenda, you have Victoza. I mean, you have all of these GLP-1s, right? And so, like, they like to say that Mounjaro is, or not that they like to say, I shouldn't use that terminology. Mounjaro is tirzepatide marketed for diabetics or diabetes. And you have Zepbound, which is tirzepatide, marketed for weight loss. Same thing. With semaglutide, you have Ozempic, which is marketed for diabetics, and then you have Wegovy, which is semaglutide, which is marketed for weight loss. But when you put the Ozempic, and mind you, I've done, talks and, forums about the GLP-1. So I think I'm pretty qualified to answer this question. But the two that tend to pull out of the class are the Ozempic or the semaglutide, which is Ozempic and Wegovy, and then the tirzepatide, which is the Mounjaro and the Zepbound. Those two pull away from the class. Because I personally think they pull away from the class because they kind of came out with like a lot of media and a lot of like celebrity endorsement and just really, really good at patients taking them and losing the weight. Because you get weight loss on the other ones. Let's just put that out there. It may not be as significant. And mind you, some people take these medications and they don't have significant weight loss. Or it's just not, remarkable. Like they have it, but it's like, But of the two, when you pull out those two, in my personal, professional opinion, tirzepatide is far superior. Now, I've had a physician say, I don't really care for tirzepatide. I think Ozempic does fine. You get the weight loss. Most people tolerate Ozempic just fine. I've had a physician say that. Like, he just doesn't really feel the need to prescribe Mounjaro. I've heard pharmacists say, tirzepatide is best in class. It hits both receptors. So you're getting dual action. You have less side effects. You get more weight loss. That's what I've heard pharmacists say. Now, from personal experience, I have personally done better on Mounjaro. Again, the less side effect profile. I didn't lose much weight on either, but if I had to compare the two, I lost more weight on the Mounjaro than the Ozempic. I'm just a little surprised that CVS made the decision to exclude the tirzepatide, and I feel bad for the patients. Again, for me, it's all about the patients, right? Because I am a patient, and I feel like my job is just very patient-centered. Like, it matters to me. I want them to get the results and the benefits that they need, which is why I don't think it was a good decision. I don't like it. I didn't see it on my bingo card. I don't like it. I don't feel like it doesn't make sense to me. It just doesn't make sense. If you were going to go that route with tirzepatide, okay. It has, again, the side effect profile lower, the weight loss profile same, cost same. There's just no real reason, I feel like, to be like, hey, we're gonna dump tirzepatide if you have to dump one. Now, what I'm interested to know is, are they not gonna cover it at all? Like, you're done? Or is it gonna be a situation where it's just not formulary, but if for some reason, like, your sugars aren't controlled on the Ozempic, or you're having really bad side effects, then your doctor can write for a prior authorization. And in cases, where it's deemed appropriate, they will cover the tirzepatide, which could totally be what's going on here. The article, I didn't even read the article. I just kind of like heard it on social media, which is bad. But it was kind of everywhere. That could be the case. But those are my thoughts on that. Lastly, It's graduation season. Congratulations to all of the graduates, specifically the pharmacy graduates. Congratulations to you guys. You've done it. You have done the hard work. You have made it to the finish line. You are PharmDs. And over the next few months, you will be preparing yourselves to be registered, licensed pharmacists. Pat yourselves on the back for a job well done. From one pharmacist to another, the journey gets more interesting each year. I am more grateful, more thankful, more in love with this profession at almost year 9 than I was at year 1. It just keeps getting better if you allow it to. There will be ups, there will be downs, but it will be great. If you find yourself starting off in retail, enjoy it. Learn what you can learn from it. Experience all that you can experience from it. Let it teach you, let it mold you, let it make you. Where you start doesn't mean that you have to finish there. It just doesn't. And don't let anything or anyone make you believe that. You have done the hard work. You will do the hard work to become licensed. A pharmacist is a pharmacist no matter where they are. And the only difference between you as a pharmacist in your setting and a pharmacist in another setting is your experience, what you've been trained to do. Training it's simple. You're just trained. You're trained to do it. So don't get caught up in where you are right now. Enjoy it. And if you're not happy, if you find yourself not happy, look around. Never stop interviewing. Never stop looking. It keeps you fresh. It keeps you sharp. It keeps you competitive. Networking is going to be the single most important thing in your career. It's never going to be about what you know. It's going to be about who you know. Who you know gets you there. What you know keeps you there. Remember that. So network. Join the associations. Go to the mixer dinners and be active on LinkedIn. So many opportunities that I've had throughout my pharmacy career have been from LinkedIn. I'm an advocate for it. Just making those connections, being social in those groups, whether it's at the state level, the national level, it really is going to be a benefit to your career. Going forward, I will do more videos. I will do, more content around my career and tips and tricks and suggestions and all of the things, but not to overwhelm you in this graduation season, because you will have enough to worry about in the coming weeks and the coming months. Right now, just bask in the fact that you have completed, most of you have completed your didactic training, because some of you will go on to post-secondary education, and that's amazing. But this chapter, the PharmD chapter, is done. This has been a Yip Yap that has been all over the place. But I can talk anytime, anywhere about anything. And if you would like to become a part of my community, please feel free. I invite you, I ask you, I offer up to you to subscribe to my channel, turn on the notifications so that when I post, you get them. Leave me comments and suggestions. If there are topics or things you would like to have me discuss or content you'd like to see, I'm certainly open to that. And until next time, what I hear is now become my signature thing. Bye.